Okay, hello everyone. This is Carolina Cornejo from the government of Argentina. We are going to go ahead with this webinar on open service delivery in health, communities and governments working together. Why don't you all start introducing yourself on the chat box, telling us who you are, where you're from, which city, which country. Together with me, I have Aidan Iyakuse, Executive Director of TWAWESA from Tanzania, and my fellow colleague, steering committee member.
Hello, good morning, good afternoon, and good evening. Thank you, Carolina.
Hi. I also have Florencia Garzovich from Politeia Group and Santa Catarina State University. Hi, Flor.
Hi, everyone. Good seeing you.
Also, Undersecretary Luz Iligan from the Philippines. I think
Luz's mic is muted.
Okay. I see Alison from the OGP support unit on the chat. Bianca, Maureen.
Good evening.
Good evening, Luz.
From the Philippines, Luz Ilagan.
Luz Ilagan.
Good
Hi.
evening, good morning. Hello. Hi.
Hi, everyone. We have online some instructions. If you have already downloaded the Zoom app, you will have available this feature for online interpretation. Beware that I will be speaking Spanish in a few minutes as we start. But just to remind everyone to keep introducing yourself on the chat. David Jacobstein from USA in DC. Jonah from Albania, Courtney Tolmy from Results from Development. Hi, everyone. Ecuador, the Americas region present. Hi, Ainura. Marta, Monica from Argentina. Solga Tony. So keep introducing yourself in the chat. We will be starting in 2 minutes. Adan, hi, from Global Integrity. Betty from East Africa. We have also our fellow speakers. George or Say, hi. We'll be introducing them soon. Also Bessie Nati. Okay, keep introducing yourself, Delfina, Paula, Rodrigo, lots of people. This is the second webinar, or the third webinar, in fact. We had 2 webinars yesterday in the frame of the Open Response, Open Recovery campaign. I see lots of people connected. So this webinar is framed in the Open Response, Open Recovery Forum, which gathers open government champions and explores what governments and civil society organizations all over the world are doing to preserve the principles of open government amidst the challenges posed by the coronavirus pandemic. Thanks to Apolitical for hosting this webinar together with the OGP. So we are just 5 minutes ahead, so I will just start. Again, I'm Carolina Cornejo. I'm the Director of Open Government at the Cabinet Office of Argentina. The government of Argentina is OGP co-chair, together with Robin Hodes. We are very glad to have you all connected. And as I'm from Argentina and Spanish is my native language, I will now switch off to Spanish so you can turn the feature if you want to have online interpretation.
He is Executive Director of TWAWESA and OGP Steering Committee member. That's Aidan Iyakuse. He can be telling us what we can do inside and outside from the OGP in order to respond to COVID-19, an open response on transparency, accountability, citizenry, engagement. We are convinced that that is the only way that we can pull out from this pandemic and get close to an open recovery. Quite convinced that things must change. The COVID pandemic makes us innovate on public policies and think how we can be responding to the most urgent needs. This is the time to come back to OGP, that is to improve services to citizenry. It is more important than ever. Half of the world is in isolation. They are in a stay at home. We have more than 3 million COVID cases, 250,000 deaths due to COVID-19. So it's an emergency and it's a right. How can the state continue to provide services in the midst of this emergency? Or let's ask ourselves, can the governments by themselves continue to ensure the minimal basic services? That is why we encourage you to participate in this session, not only because public services are in the heart and the core and the 3-year plan of this partnership, but we know that only with civic engagement in the participation in the provision of services is that can we push forward politics as a response to COVID-19. If we want to have an open response, if we want to have an open recovery, we need to work together, society and governments as well. So what we are trying to do here is that the pandemic will not be something that is not useful. Without further ado, I will give the floor to Aiden, who will be moderating this session. Thank you, Aiden. You have the floor.
Thank you, Carolina, and good morning, good afternoon, and good evening to all of you who are joining this webinar. It is our pleasure to host you. I am Aiden Yakuze. I live and work in Tanzania, in Dar es Salaam. That's where I am at the moment, and it's a pleasure to moderate this particular conversation. I want to just dive right in, really, and so that we can spend time learning and hearing from one another. But just by way of introduction, I'd like to just say everybody knows that what was started as a health crisis has become an economic crisis, a social crisis, a political crisis. And we have to try and address it on all of these fronts at the same time. And it is beyond the scope of any one government or any one group in society to be able to do that. But we want to focus a little bit here on collaboration and specifically on how we can collaborate and work together in terms of delivering on the health, service delivery in health in an open manner. I think, as Carolina probably mentioned in Spanish, for the non-Spanish speakers, just some quick sort of background or housekeeping things to help us have a smooth conversation. So this is part of the Open Response and Open Recovery Forum. We are going to discuss actions, what are the roles and synergies and challenges that are required to try and deal with this COVID crisis, but focusing on health. Who are the actors who must come together? So this is including government and civil society and private sector and others, religious organizations and leaders to come in and to do what exactly? What outcome are we looking for? How can they shape? How can we collectively deliver on improved public services? How can we monitor that these are actually happening? How do we make sure that people are not being left behind, especially in these times of emergency? So we want to ask you really to engage with us in the chat. I can see lots of people are already introducing themselves in the chat, but go beyond introducing yourselves. I think you could just make your comment, add questions, and we shall try and get to them in part of the conversation. We're putting you sort of on mute by default so that we can hear one another in our conversation here. So in terms of how it will flow, we have organized this in about 4 different blocks. We'll have one part, and then I'll introduce the speakers under each part of these. We have part one. Part one of the flow will be talking a little bit about open responses and hear real practices on how collaboration in an open manner led to improvements in health service delivery outcomes. And here we will get some intervention or contribution from Luz Ilagan from the government of the Philippines. And I'll introduce her when it's the time to come. We'll also get some intervention from our friend John Maritim, Director of Economic Planning in the county government of Elgeyo Marakwet in Kenya. So that's part one. They'll each have about 5 minutes, and then we'll have 10 minutes of Q&A. Part two will then speak a little bit about how we deliver healthcare together in times of emergency. That's government and citizens. And here we're going to hear from Florencia Gurzovic, who is at Santa Catarina State University as part of the Politea group. And we'll also have Santa Catarina, I think it's in Mexico, Florencia. And then we'll hear also from George Osei Bimpe. Hello, George, from Ghana. He's the country director of SEND Ghana. And I think he has some things to boast about in Ghana in terms of the collaboration that he's been able to achieve. And then we'll go to part three. Part three will talk about looking ahead. What's ahead in terms of reconstruction post-COVID-19. And here we have the pleasure of listening to Besinati Mpepo. Mpepo sounds like a very Tanzanian name, but maybe she'll reveal where she's from. But she's a technical director with World Vision, Social Accountability, and I think is based perhaps in Indonesia. I hope I did not get that wrong. So these sort of our speakers, and interspersed will be some other potential interventions from the government of Canada and from the Global Partnership for Social Accountability, and the Kyrgyz Republic, and from the USA. So it's a really rich collection of people who are joining us today. So without much further ado, actually, I'd like to dive right into part one of our conversation, which is going to be about 20 minutes. And Luz, if you are ready, I would like to invite you to share with us your experiences. What is the situation in the Philippines today? What is, and your country committed to supporting participatory action research. Please help us to understand how you are addressing this challenge of COVID in the work that you're doing around nutrition and poor nutrition in the Philippines. Luz, welcome.
Oh, thank you. And good evening, good morning, good afternoon to everybody. Hello, everybody. So I'll begin with a brief description of our situation on the issue that we have chosen to partner with civil society in open government partnership. And afterwards, I'll share what we are doing in response to the pandemic crisis that we are also experiencing. In the Philippines, 1 in 3 children under 5 years is stunted, while roughly 7% of children are too thin for their height. Filipinos are the second shortest in the ASEAN region, 9th on the global burden of stunting, and 10th on the global burden of wasting. Our trends of malnutrition in terms of stunting, underweight, and overweight show little improvement and have even worsened over the years. 2 principal factors are associated with stunting in the Philippines. The first is poor maternal health and nutrition, which is associated in part with early motherhood, also now considered a national social emergency. The second is the poor dietary diversity of children, which is driven by both feeding practices and high prices of nutritious food. The government is focusing its efforts on addressing malnutrition, especially child malnutrition, through the Philippine Plan of Action for Nutrition, which serves as the country's framework for nutrition improvement. Nutrition-specific and nutrition-sensitive programs are being implemented to address both immediate and underlying causes of maternal and child undernutrition. Examples are infant and young child feeding and mainstreaming nutrition in sustainable livelihood. Our open government partnership commitment is the conduct of a participatory action research. The main components of which are community issues of child malnutrition and early pregnancy. Through participatory action research, the community themselves will define why malnutrition persists and propose their own solutions. The implementation plan will be supported by the local government. Participatory action research will be conducted in 12 villages with the highest incidence of malnutrition and early pregnancy based on national data. One major objective is to foster behavior change, evidenced by a higher sense of community, an increase in the demand for social services and policy changes at the local and national levels. Currently, however, because of the COVID-19 pandemic, activities have stopped and funding for 2020 is not assured because government agencies have been directed to prioritize COVID response activities. With the imposition of lockdowns or quarantine, hunger and nutrition challenges are inevitable. The poor in urban areas have a harder time securing food compared to the poor in rural areas. The national government distributed family food packs to local governments for distribution to affected families. A nutrition guideline relative to COVID-19 was issued recently for local governments and organizations providing nutrition services to promote good nutrition, prioritize households with special needs, and promote exclusive breastfeeding for infants 0 to 6 months old, among other recommended actions. Local government units, villages, cities, or provinces have been more innovative. Some are distributing Nutri-bags through their local nutrition office to targeted infant and young children and pregnant and lactating mothers to augment food pack donations. Mobile markets selling fresh vegetables and fruits have been organized to reach villages instead of the usual packages consisting only of rice and sardines food packs. More nutritious relief goods, which include meat, fish, and vegetables from local producers, are purchased from local government funds. Post-COVID, the national government has to take a closer look at how the pandemic has affected the population in terms of hunger and malnutrition, and recalibrate regular nutrition and agricultural programs to level up food security and accessibility strategies. More inclusive and even universal social protection policies and programs should be among the first agenda on the table. That's it.
Luz, thank you very much for painting a picture of the challenges that you're facing because of post-COVID, which compound the original challenge of the poor nutrition that many mothers and children in the Philippines are facing. I was struck by your comment about Filipinos being some of the shortest people in Asia. So that's something that clearly nutrition has a role to play there. But we will look forward to maybe engaging with some of your proposals in part 3 of the discussion. But thank you very much. And you were right on time. So let me invite John. John, are you online? John is my neighbor to the north in Kenya, a little bit north in Elgeyo Marakwet, in a place which produces a lot of running champions. So I assume, John, you do not have a malnutrition problem, but please tell us a little bit about your own sort of commitments in the Department of Health and Sanitation based on re-engineering public healthcare service delivery processes, and how this was working prior to COVID-19, how that commitment has has worked in terms of collaboration between government, during government and citizens, and share with us what you find personally is the value of engaging with civil society on a focus on health. John, welcome.
Thank you, Adam. I hope everyone hears me now.
We can.
Yes, Elgeyo Marakwet County is one of the 47 county governments in Kenya, and our county is the only one participating in the local OGP globally.
John, I think you might have to move closer to your microphone because you're fading. If you could move closer to your microphone, we'll hear you more clearly. Thank you.
You can hear me now?
Now that's very good, yeah.
Great. Now, I was saying our county government is the only one in Kenya participating in the OGP, and we have, in the current action plan, we have 5 commitments, and one of them is re-engineering of the healthcare delivery in the Department of Health and Sanitation. Aidan, you can hear me? I hope everyone does. Perfect. Now, basically the objective of that commitment, well, just to give a background of what has been the problem which made us to make a commitment on the health service delivery, is that in the past, we've been allocating a lot of resources locally to healthcare, especially on drugs. And we still haven't really, we expected that all the patients visiting our health facilities will not miss out on the prescribed drugs. But unfortunately, the reports we got over the years is that the prescriptions they received, they will not find in our government-run facility pharmacies, they will not get most of the drugs that are being prescribed. So we went out to find out what was the problem. And when we were doing the action plan, the current one, and we went for the citizen listening tours to help us to find out what was the problem, the public pointed out that most health facilities will stock drugs which may not necessarily be of their need, because, as you know, Hayden, in the tropical areas, we have different tropical climatic conditions. So diseases spread will not be the same in all the areas in the county. So in that, we engaged civil society in the local communities. We also engaged the communities. And as you know, in Kenya, probably, Aidan, is that local health facilities are mainly run by citizen committees. So we engaged them and were able to come up with the action plan, which mainly targeted automation of delivery of service, and mainly on the availability of drugs. So we will use the data coming from captured for the patient visiting hospitals for whatever reason. And then from there, then we will determine what kind of drugs do they require. So that commitment was basically to automate the drugs management system and also the health service delivery systems, including even the availability of doctors who are in specific areas. If a patient, for example, will want to see a dentist, which you will not find a dentist in all the health facilities within our government. So then in that automated system, then the citizen will know that for my ailments, I'll probably have to visit facility A. And if a patient also suspects that a particular disease they suffer from, may not, in the nearest health facility, may not be stocking the drugs which will address the disease, then they will visit the next one. So we really wanted to come up with an open information access to the citizens so that they can make the right decisions whenever they wanted to visit hospitals. As you know, also, Aidan, I know in Africa, most of our health facility practitioners have been accused of running parallel pharmacies across urban areas, and usually probably they source most of the drugs in those private clinics from the health facility. So we wanted, like, the civil society using the automated system and the citizens to help. They will look like they're enforcers or information givers whenever they suspect that there is drugs being mismanaged by health workers. So from government, also from ourselves, it really, so far, you ask about the outcome. So far, from that, there is a big awareness of the citizens and the patients accessing hospitals on what kind of services do they expect to receive from the hospitals. And we've also went further, and we've gone further to have specified citizen service delivery charters per facility, given the area of focus for that facility for whatever disease. So it's very easy for the citizens to visit. Unfortunately, now to come now to the current situation of COVID, in our county, yes, we've not had a case so far. We've been lucky, at least the official figure. So we don't know if there are people who have not been tested, because the testing here is very low. But nevertheless, we've not stepped down our guard in terms of preparation. So what we've used when we were forming the county COVID emergency committee, we kind of build it from the multi-stakeholder forum, which usually runs the OGP related commitments implementation. So immediately I can say within this period, although we've been impeded by the COVID in terms of allocation of resources for that commitment, I can confidently report that all the members of the multi-stakeholder forum for OGP were adopted as members of the larger committee of the emergency for COVID-19 in our government. So basically that is what it is. But just to touch on the value of
1 minute. Yeah, 1 minute.
Yes, just to touch on the value of CSOs and citizens in the implementation of the commitment. Just to say, we are almost finalizing on the automated system, and it is not done through our resources in government. We engaged, we partnered with the Transparency International, and they brought on the expertise and the knowledge they picked across the world, and we are very happy that the system, courtesy of Transparency International, is coming to forth. And then secondly, that commitment has enabled our county to come up with what we are calling government CSOs roundtable, where we meet every 3 months, and they tell us in health, this is the area that you're doing very well. In whatever sector, these areas that you need to improve. So that is a value I can cite as doing together with the citizens and the civil society. I know questions will come. I'll elaborate on more. Thank you.
Yes. Yeah. Thank you very much, John, and thank you very much, Luz. So those are the interventions from the first part, showing us in Kenya and Philippines how citizens are being included in some of the analysis and the policy work, that the policy decisions that come out in terms of improving nutrition in the Philippines, availability of medicine in Elgeyo Marakwet. So let me open up if there are any questions. Maybe I can start with already one question that was asked on the chat. Just in literally 30 seconds, John, a question for you. John Maritim, why do you think other counties have not embraced open government partnership in Kenya? This is a question from, I think, a fellow Kenyan. Why do you think the others have not embraced it yet?
Yes, I can't say they haven't embraced, because we've had a lot of visitation, what we call locally as benchmarking from other counties. And we believe the lessons, some of which I'm sharing here today, have been incorporated in their various policies in various counties. So I can't say they haven't fully, but there is a lot of indications that they want to learn from us. Yes.
Yeah. Thank you. Thanks very much. I know one county, I've got them in my back pocket, who are interested in becoming members of the OGP as well. I think we'll hear from them at some point. I don't know if there's any other questions or comments from others. I don't see any in the chat box. Do you, Carolina? Because if not, I'm going to actually invite, if we can, Jason. Jason Lawson is with Culture and Partnerships Public Health Agency in Canada. Jason, are you on the call? Maybe I can invite you to give us 2 or 3 minutes of your own contribution on this issue of open health provision, health delivery services. Jason?
Absolutely, and thanks for having me today. So my angle on this is probably a little different than what we've heard already. The area I work in the Public Health Agency is what we call a data partnerships and innovation hub. And so our objective is actually use and distribute and disseminate data so that we can kind of put it in the hands of people, decision makers within the Public Health Agency of Canada, decision makers at the provincial level for us, or even empower citizens to use data and to kind of learn from it, and so that they can be empowered to make their own decisions and to be informed. You know, at the end of the day, information is power, and we want to make sure that people understand that and that they can work with it. So in terms of kind of open data and collaboration that's happened on this front, it's been quite impressive, actually. The efforts in academia, internationally, have actually led us to be able to develop and deliver products for our government. The European CDC has come up with a data platform, and it's running so smoothly that we don't have to replicate it. So we take a lot of data from there. University of Toronto here in Canada has made a lot of efforts internally to develop some data sheets and things that can be used. And in fact, they're being used across the country by governments, by private industry. It's this effort of citizens to get involved that has been so refreshing, in the sense that it empowers others to focus on what they're good at, because there's kind of a collective effort. And then there's University of Oxford as well in England that's come up with a stringency index of measures in response to COVID that have been useful to us as well. So basically what we've done is that we've taken kind of all these open data sources and kind of built them into some of our platforms. And some of them are internal for our decision makers, but others are actually disseminated back out to the public. So we've produced a dashboard that gives real-time, or near real-time, I should say, information to Canadians on the progression of the epidemic in the country, and how that relates to different factors driving it. And then the last thing I'll say is,
Jason, can I interrupt you, because Jason,
yep.
There's a question directly at you, and I think you can hear me. There's a question from one of the participants who says she would love to hear how Canada is approaching disaggregating health data by gender, sex, age, race, ethnicity, etc., by various variables, and feeding that back into policy making and, crucially, citizen engagement. And my own question on top of that would be, how are citizens actually directly one-on-one accessing and using this data for their own decisions?
So two good questions. So I'll answer the first and foremost. So there's different ways that we're getting the data in. One is from cases in hospitals. There's a system there, but as I'm sure everybody can relate to, it's quite a burden on those healthcare providers to be thinking about the data that they can provide back up to whatever government organization. So we've tried to find different ways to crowdsource information as well. So there's a variety of apps, and there's one that we've partnered with in particular, where people that have symptoms can self-report those symptoms, and there's some demographic information attached to that. So the question of disaggregating health by gender, sex, age, race, ethnicity, etc., is one that we're looking at, but it's a delicate balance for us, frankly, between trying to draw as much information out as possible from what's out there without burdening the healthcare system more than it already is. And then
and citizen engagement.
Citizen engagement is really, I think it's we're working on apps. I think that would be the key there, is that we're focusing on apps that are collecting data right now, but also looking into ways in integrating things back towards those citizens through those apps. So giving them information, giving them recommendations, things that they can do in order to make it kind of a two-way communication through those technologies.
Thank you, Jason. Caroline, I'm going to ask you to just quickly translate a comment from Miguel. It's in Spanish. I wish I could do it, but I think I'll mess it up. The comment from Miguel, you could just share with everybody who does not speak Spanish.
Okay, Miguel is saying that partnerships on open government in each country should try to to engage and try to decentralize capitals in each country, and the connections between government and civil society in each country. It seems that cities and capital cities are centralizing all the nexus and the connections between the open government community. And that's in fact at the core of OGP Local. The idea is not only to promote local open government, but also the new local strategy, and I'm just jumping into this. The new local strategy also has the idea to try to articulate national and local. It's not just locals, but try to build more connections between the two ecosystems.
Yeah.
But I
Thank
can
you,
translate
Caroline.
on the chat. Thank you.
Thank you. Let's move on to the second block. Now, this one is about open discussion, right? The first one was about open practice. This second one is about open discussion in this part. And for the next 10 or so minutes, I want to invite two more panelists, and then we can open up another questions. Let me invite Florencia. Hello, Florencia. And I think you are in Mexico. Please correct me if I'm wrong. Florencia Gurzovic,
Hi, I'm in
Santa Catarina
Brazil.
State University. You're going to have to speak a little louder, Florencia. But here is the thing for you here. Please tell us a little bit about how do we deliver healthcare together, right? As government and citizens, especially in times of emergencies such as this one. Where is the room for collaboration, right? And is this emergency an opportunity or a threat? Florencia, welcome.
Thanks, Aidan. I first want to also thank the government of Argentina and OGP and Carolina for leadership and for breaking the rules on this one, too. Last November, a group of colleagues, some of which are on the line, and I convened people from around the world who are interested in what social accountability for service delivery looked like. And they told us that they saw their role as fostering trust and relationships between communities and governments, and using this social capital to solve problems of service delivery. Think of working with mothers and community health workers and nurses and teachers to ensure that kids get the right nutrition, as Luz was talking. Fast forward to COVID-19 times, and I think I want to highlight 3 points to answer your question from that conversation. The first one is that good ideas can come from everywhere. The second one is that relationships matter to transform those ideas into collective action. And the third one is that health is everyone's business, including the open government movement. So my first point, as we've heard, communities and governments have had to mobilize very quickly to get meals and protective equipment to those that need it most. And that's whether in the US or Argentina or Italy. And different actors have come up with insights we see every day on TV, right? That help us navigate the COVID-19 response. And eventually, I hope the reconstruction. And this reminded me of this OGP old-timer phrase, right? Good ideas can come from anywhere, right? But my second point, investments in relationships and trust that connect us to relevant actors, as John was talking about their group, right, getting together, matter to transform those individual ideas into collective action. Civil society groups that have a trajectory of working with the health system in the front line have a stock of relationships and knowledge that I would say is a critical asset for an open response and open recovery. What that may look like, well, along with citizen-driven information to monitor care, I would say that as important is thinking about what we're doing all trying to flatten this curve, right? So it's a collective action effort to stretch respirators and support healthcare workers so that doctors don't have to decide who dies and who may live. We want to prevent the problem. And we need to stand about 2 meters apart. We have to wash hands and wear masks. That's a massive shift in social norms super quickly. And while governments and journalists and experts can give us information, they cannot be everywhere to enforce compliance. Trusted leaders in the community are playing key facilitation and brokering roles between the old norms and the new needs. And local leaders' ingenuity and deep knowledge help bridge this voluntary compliance with new norms. They mobilize solidarity and cooperation, and also trust in authorities. I see in my own neighborhood community association WhatsApp group every day. And we also see, sadly, that when actors we trust don't play a constructive role, it's the community that suffers the consequences. We saw this during the Ebola crisis, and sadly, we are also seeing it today around the world in many places. So my last point, health is everyone's business, including the open government movement. When government doesn't engage meaningfully society, it misses on key resources to deliver healthcare. Synergies matter. Flattening the curve is something that neither public sector nor civil society nor the private sector can do alone. And I think it begs repeating, as much as we like to put open government first, it's a pandemic. Those that are in the health system are front and center. We need to chip in and support, whether it's the WHO or your local health center. And that means thinking how we support them. And I think I saw Sanjay in the chat, as he put it, open response and open recovery require that we broaden the base of the open government movement to ministries dealing with health and safety nets. But I would say it also requires broadening the base to include civil society groups who have been engaging people for service delivery in communities around the world for decades. And that is whether the social accountability movement, the community-driven development movement, the universal healthcare movement, or your local voluntary group. So I'm super happy that today we're reaching out, and there are many people from those movements in the line from what I saw. And I think now it's a time where we need to take what is happening in our daily lives around the world and think about how we can put OGP to work hand in hand with these efforts to strengthen health systems.
Thank you, Florencia. That's a great question to end on. And I'm going to pick on your second point about, if I may look at my notes here, investing in trust, invest in relationships and trust, because these help transform good ideas into effective collective action. So on that note, I want to invite, it is George Osei Bimpe, who is country director of SEND Ghana. You're going to have to tell us what SEND Ghana stands for. But I'd like you, if you don't mind, speaking a little bit to the successes of the collaboration that I think you have been working with the Ministry of Health, or midwifing between the Ministry of Health and the communities with which you work. Tell us a little bit about how you got there. How come you're so successful, and what is the secret ingredient that the rest of us can pick from there? And secondly, how do you think you're going to build on these to deal with the COVID challenge? Welcome, George.
Thank you very much. I think in terms of the how, many of you may already know, but basically we invest a lot in building partnerships. So I'm going to tell you what we have been doing since COVID-19 so that we can situate the discussion. Basically, partnership is happening not only between government and civil society, but among civil society. So in Ghana, actually SEND Ghana is the host of the Ghana CSO platform on the SDGs. And so that trusts onto us some responsibility in terms of providing leadership in mobilizing civil society around COVID-19. So civil society, we have been working together. What we are seeking to do is we want to coordinate our own efforts, the civil society's own effort, with the aim of complementing government. And so working together, we have set up a civil society COVID response fund. Basically, the fund is raising money from among civil society. So some of us are donating salaries and so on and so forth. And already we have raised approximately $30,000. And with the $30,000, what we have been doing is basically to complement government effort. Government has been providing social protection to some communities, vulnerable groups. We realized that people like widows, aged, street children, and persons with disability were not getting from what government was giving them. So the first phase of our effort has been to target that. Then in partnering with government, we realized that, and so we have already given out rice, oil, soap. We emphasize soap. We didn't want to buy hand sanitizers, but we bought locally made soap because these are vulnerable groups. We are encouraging them to wash their hands rather than to be using hand sanitizers. And to use soap, in Ghana, it will be very interesting that some people cannot afford antiseptic soap. So we are providing that. And we have also been providing vitamin C. Vitamin C just to boost the immune system of this. All of this is complementing government effort. We realized that the National Commission on Civic Education is supposed to undertake public education, but up to now, they haven't had their budget released for the whole year. And so that's a major problem. And so what we have been considering in the second phase is to support them with some financial, some funds from our funds that we are raising for them to buy fuel. Basically, they don't have fuel to go around and do public education. So it's a major issue. So we issue a joint statement encouraging the government to make sure that they have released their funds to them. But we said that we need to back that with action. So in the next couple of days, we'll be making some donations to them so that they can buy fuel. Even if we give them 20,000, roughly, that should be about $3,000, $3,500, or $4,000 for them to buy fuel so that they can do public education. We realize that people are not, some are still in doubt. They don't see people who are in the hospitals. So they're asking, so where are the numbers that they are talking about? So we see that the doubt social distancing is not going on because of the education one. So what we have then done is that government education is not going well. So we are in discussion with the Ministry of Information and Ministry of Health, the Ghana Health Service. They have developed information communication, information education material. So we are taking those materials and we are giving it to our members. There are about 400 CSOs working in different districts. So we are giving them these ones and providing some logistic support to them so that they can use the education materials to educate the population.
Okay.
Quickly, just to wrap up. Yeah. In terms of opportunity and threat, what happened was that because this is an emergency, when government was putting up the committee that would be coordinating effort to fight COVID-19, they didn't think about civil society. That was a major oversight. And so in an emergency situation, government can lose sight of the fact that we have nurtured a culture of working with civil society. So they just put up a committee and we are asking, so where are civil society in this? But what we then said was to approach the committee and say, how can we support your work? So we will not sit down and only criticize, but we have approached them and they have asked us to submit a paper on how we can support them. The opportunity is how we, civil society, see the need to coordinate our effort. So within the broader civil society work, not only are we raising funds, but we are also promoting good governance in the COVID-19 effort. So some of us are mobilized, some of us are monitoring and tracking government expenditure and monitoring who is getting government support. And also looking at the issue of not forgetting about other diseases. In Ghana here, malaria kills people more than COVID-19. Meningitis has killed over 35 people. And so we are looking at how government can pay attention to other health service provisions so that we don't lose sight of that. Thank you very much.
Thank you very much, George, for that. I have to say I picked very quickly the interesting point you make about civil society raising money to buy fuel for government officials. I found that very, fascinating. It's something I think that we're also doing in Tanzania. I can see John smiling knowingly in Kenya. Yeah, this is something that we seem to be doing. But the other point that you make, and I'll open up for questions, is the fact that civil society was sort of set aside in the plans that I've read about my own country in Tanzania. Civil society just isn't there at all in terms of a COVID-19 response. So that's fascinating. Let's see. I know there's going to be questions sort of at the end, but there are a couple of questions here. Maybe Carolina. I'm finding it. There's so many. Could you pick one for Florencia? There's one, and there's one for George. But after Florencia, let me look for the one for George. One saying, George will say, your interventions are very realistic and happy that your government is not very restrictive on how other players can complement government efforts. This is from Martha in Uganda, and I completely echo her point. So, Carolina, do you have a question for Florencia?
Can you repeat my question, please?
It was a compliment, George. That we are happy that your government is not very restrictive on how other players can complement government efforts. We are applauding your government.
We are using a whole society approach. That's what the president said during the first speech.
Thank you. Carolina, for Florencia? Yes, for Florencia. What is the best way of engaging with the government remotely and collaboratively? And what is the best way of working collaboratively and remotely as a collective group of diverse but interconnected stakeholders? Quite a challenge.
Yeah, so it's not easy. I was reading this morning a blog from colleagues from the Universal Healthcare Coalition, and they were saying that in the countries that they mapped, most decisions are being made by male experts in national government. They're leaving behind a lot of people, and they're not using societal resources. As George or John can tell you, I think that especially at scale, collaboration is not something that you build one day to the next. I think at the local level, sometimes it's easier because you have the nurse or the doctors or the council person's WhatsApp on the line already. And I think that's my point about the role of relationships and investing in those relationships over time. And I think that's where we can take on the stock of what we've done, where there are platforms like the OGP, where you have collaborative social accountability processes, where you have health councils that have been mobilizing stakeholders to work together. This is to be checked, but it seems that it's easier, right? It's easier to pick up the phone. It's easier to set up a conversation on Zoom like we're doing here, right? To have a chat and think about the future. So I think it's this twofold. Let's take advantage of what we have, and where we don't have it, let's think about how we make it stronger, because this is not going to go away. This is going to last quite a while.
Let me just invite Richard Mabala. Richard Mabala, are you on the line? You make an important point, but I don't want to ruin it by paraphrasing. Please make your point in person about especially involving citizens in the education. Richard, welcome. Richard, you're unmuted, but we can't hear you. Well, that's a shame. We can't hear Richard at all, but maybe let me see if I can find the comment that he made. And that is, he's saying in the chat, I would like to know what initiatives have been taken to involve the people themselves in their education and follow-up as actors rather than as target groups. They're the ones who have to balance life and livelihood. How are we involving them in finding the right balance between the two? To me, this is the best way of investing in trust. So maybe either one of you, George or Florencia, can sort of respond to that. How do you actually get citizens to be actors rather than just mere recipients? George.
Okay, thank you very much. So, like I said, I recall the first speech that our president gave and said that this is a problem for all Ghanaians. And so you realize that the government set up a fund. And that fund, we have individuals, churches, groups making contribution to that. So far, we have raised, that government has raised about 35 million cedis. Divide that by 5.6. That will give you the equivalent in dollars. Then, when we realized that in the coordinating committee that they set up, it didn't involve us, we said this is the time for us to assert our relevance as a group. So we would rather be proactive. And in doing that, like for instance said, we have built the foundation in terms of working with the health officials. So we don't need to start afresh. That would take so much time. At the moment, everybody is busy. We are trying to. So all that we said was that what we discussed with the Ghana Health Service was that we, in addition to everything that we can do, we can play a major role in terms of public sensitization. Already, our members are in the communities doing, without any prompting, they were already doing sensitization. We had to realign our activities to say, how can we do this? Then one thing that really has helped that was the media. Here in Ghana, the media themselves developed their own jingles. They looked at the World Health Organization information and used it to develop their jingles. And in the media, some of them even changed their programming to only talk about COVID-19 24 hours. And so some of us have been speaking on the media, giving comment, passing comment on what government is doing, so a kind of giving feedback. So we have our colleagues in the communities telling us what is going on, well, who is getting the support and who is not getting the support, and then channeling it to the media for them to pass it on to government. So we have been using informal systems to kind of get feedback into government, because we can't use the formal channels now. Thank you.
Thank you very much, George. Let me, for the last 3 minutes of this segment, and then we'll move on to Bessie-Natty, invite Derek Thorne, who is doing some interesting research. He is asking this question. Maybe, Derek, actually, you ask the question yourself and potentially partially answer it from your research around collaboration with government by CSOs and the ability to criticize them. Derek, welcome.
Thank you, Aidan, and thanks everyone. Hope you can hear me. So yeah, my question, I was really interested to hear about how George and his fellow civil society actors had been supporting and complementing government as a sort of first step, rather than saying, okay, we're here to hold you account as the first step, because that certainly seems to build trust. My question was basically, once you've done that, does that then make it easier for you to criticize or hold government to account when it's needed? And I asked that particularly because I think we're struggling, and many organizations are, with how difficult this particular humanitarian health response is to hold to account, with the restrictions on people's movements, on people associating, and all of that. I'll leave it there for the moment rather than go into any findings we've got, because I would like to hear any responses on that.
Well, Derek, you have tickled all our fancies. You're going to have to share those findings somehow.
Okay.
Yeah, so even if it's in 30 seconds, a very quick bit, and then tell us where we can look for it online somewhere.
Well, there's actually some stuff we're commissioning at the moment, so I don't think, I'm not sure we've got stuff that we could actually share right now. I will definitely share it with the community in OGP.
All right. Thank you all so much. Don't go away. Let's go now to the third round. I see Bessie-Natty has put her camera on so that we can all see her. My first question to Bessie-Natty before we get to the substantive one is, where are you?
Thank you so much, Aidan. I am from Zambia and based in the UK.
Aha, so you're in the UK at the moment.
I am.
So, Bessie-Natty, we left the easiest question for you. What next? What happens next? What's ahead of us post-COVID-19, especially on this issue of social accountability? How citizens can work with government to make sure that they're getting what they need from government, and they're holding government to account, and they're also contributing to that. How do you envision the future And you've got 5 minutes to envision a beautiful future.
5 minutes is, it's a challenge, because I think it's a future that we are working on together and collaborating. As an organization, World Vision, like many others, is working to respond to the current crisis that we found ourselves in. And we're responding both from the prevention side, but also support to strengthening of health systems, and also the children that have been impacted by COVID-19. But we also really recognize that it is the secondary impact that threatens children's lives, probably more than the disease itself. And one of these impacts can be seen from the overburdened, overwhelmed health systems. And how do we then get these health systems, how do we restore them so that they can provide and respond to the needs of local communities? And from the evidence that we have, we know that social accountability can definitely support this. And even from the contributions that have been given so far, the different contributions from Florencia, the questions that Richard is asking within the chat, they all touch on this very important issue of social accountability. And that's the angle that I'm coming at it from. And I have a few points to share on this. But I think the first thing that I would like to say is that we all recognize that it is the worst off now that actually will be the worst off. And these have to be right at the heart of any interventions. The disruptions to livelihoods are clear. Social protection that was mentioned by Louise is really important, whether it's child and gender sensitive social protection is going to be really, really important within this space. And evidence shows that when you bring social accountability alongside these different interventions, it helps to reach those that are really targeted. Indonesia is one of the places that we have done a lot of social accountability work, and we had a program that was funded through the World Bank's GPSA, and that particular program included an evaluation, and that evaluation showed us that social accountability could lead to the strengthening of health systems, but also the changing of power relations. But in order for this to happen, it really needs to be contextual. So one thing that we need to bear in mind as we move and maneuver through this COVID space and through into the recovery is that it is not business as usual. The core pillars of social accountability around information, voice, dialogue, and accountability, they can be enabled, but they need to be contextual, they need to be adapted, we need to employ innovations. And we're hearing about these different innovations, and really pleased to hear what John shared from Kenya as well. When it comes to information, I just want to underscore, I think, 2 points on information. The first one is that we really need to ensure that local communities are getting information around what services they're entitled to. So what have the standards changed because of the pandemic? And if so, what should they expect? How can they access them? Even within the UK context where I sit, we found that a lot of people were not accessing services that were actually due to them despite the pandemic. People just, really important to have clear information. We've seen that the organizations such as the Government Watch in Philippines that have produced a COVID-19 entitlement map, which is extremely useful in trying to identify what are the different services for local communities from different levels of government. And of course, John has also shared from the Kenya side. But then there's also information from the other perspective. So when you look at citizens as right holders and people that are able to provide extremely useful information to strengthen the systems themselves, I think it's critical that we have very clear spaces for feedback. So what are those spaces? How can information be provided? And I think Richard's question within the chat box was, what about the dialogue, the two-way information? And are these different spaces for feedback enabling that two-way information? We have some experience, for instance, in Uganda, where a WhatsApp group was set up to enable health authorities, groups from the community, health committees, social accountability groups to really exchange information in terms of what was happening around particular facilities. And our learning is that that helped in the redistribution of resources. The last point that I would like to say Aiden. And sorry, I should also mention that there's a lot of really successful examples out there that we can learn, and we're learning from World Vision, but also we know Taweza has got some really good work in this space. The IBP has also got some really good work in this space around two-way communication or one-way communication in the context of social distancing. And we're learning that as well as World Vision. So my final point on this is that, you know, before the outbreak, in areas where social accountability was happening, the language was around communities being claimants with rights and entitlements. During this outbreak period, we're hearing more language around communities being beneficiaries. And this is because, you know, there are different actors that are working alongside government to provide services. I think it would be really important to ensure that post this pandemic, as part of the restoration, we need to ensure that if at all relationships are broken between communities and their duty bearers, this needs to be part of the restoration process. It's really important to build that, strengthen the feedback loops, and put local communities at the heart of the restoration process. So I'll pause there for now and can engage later.
Thank you. But can I'm going to take the chair's prerogative here and ask you on that last point that you make, which struck me. You're saying there's a shift in narrative from communities as claimants to communities as beneficiaries. And I'm hearing in your voice that you don't like the second piece, because the second part is communities becoming passive recipients of the largesse of government or donors or, you know, do-gooders. Is that correct?
No, I think everything is. Yes, everything is really, it's contextual. I think it also depends on who is providing the services. We need to recognize that citizens have a contract with their governments, with duty bearers. That is it's a legislative, it's constitutional relationship. There are other service providers like World Vision. As an agency, we come in to support in this very important space when the governments are constrained. It is not the same relationship that we will have with citizens as the citizens would have with their governments. So when things are improving, we expect that relationship between governments and their local communities is strengthened. So that language and narrative, we need to ensure that it doesn't undermine that relationship between governments and providers. But it is, that is the context.
It's crucially important. It's so easy to lose sight of that when you're trying to deal with an immediate emergency, isn't it? But it shapes how things then progress forward for a very long time. It shapes the institutional structure between people. This is getting very exciting and time is running out. But I don't know whether anybody has any specific questions. Carolina, have you spotted any question for Bessinati that you want to ask her from the chat?
Yeah, we have lots of questions. How to build on pre-existing investments or commitments and strengthen the role of the OGP as a trust builder platform. Also about adaptation, also about how to adapt social accountability mechanisms in the context of this pandemic. What is the main platform that governments are using to coordinate efforts with CSOs, networks, and coalitions? Those are some of the questions, and I'm taking them to the chat, but maybe, Bessie, if you want to react on any of them.
Maybe before Bessie comes in, I'm going to actually ask Jeff. Jeff Tindwa, I saw you appear at the beginning of the webinar. I hope you're still around listening to us, but Jeff, you have worked at high levels in the global, I can't remember the name, what is called, the one in World Bank about social accountability partnership. There we go. The Global Social Accountability Partnership. What is your own view about this whole collaboration and the future, the vision? Are we really at a point where there's going to be some institutional reformation here, or are we going to go back to business as usual? Jeff? I think Jeff is gone. We've lost Jeff. Oh, that's a shame. I wanted to hear from Jeff on that particular point. But maybe back to you, Bessinati. That you worked with GSAP, I think. You're familiar with that.
It looks like Jeff is back. It looks like Jeff is back.
Jeff, are you back?
Okay, maybe not.
Maybe he's
Okay.
still on mute.
All right.
Jeff, maybe you could answer the question in the chat, but Bessinati, over to you.
Sure, sure. I think
here's Jeff. I can see some light at the end of Jeff's tunnel. His audio is having trouble, I think. Back to you, Bessinati, on that issue of institutional transformation or not.
Yeah, no, I think I wanted to maybe tackle the issue around adaptation. So I think there are some questions around OGP more broadly, and maybe some colleagues from the OGP can respond to that. I think that it would be really important to learn from this process, because this is unprecedented times, and it would be great to see how this process of open government during such a time will inform any future commitments within the OGP country action plan. I think it would be really important to see those. In terms of adaptation, so I mentioned a few examples of adaptation, and I think we're learning as we go along. There's adaptation in the area of information provision, and I think it's really important to use innovation or to use different ICT methodology. At the community level, we need to recognize that inclusion is extremely important. So if we're talking about sharing information or ensuring that feedback mechanisms are only through smartphones, then we're going to exclude a large part of the population. So how do we ensure that, you know, we use community radio, that two-way discussion on community radio? Working with faith leaders has been really important for us. We have the whole Channels of Hope methodology as an organization that has been really useful. So I think there are different ways that we can adapt, and adaptation, as you know, is contextual. So yeah, we're learning as we go along.
Thank you so much, Bessinati. Jeff raised his hand. I hope your microphone and your audio is sitting at your desk. Welcome, Jeff.
Hey, welcome. Can you hear me?
Yes, we can. We can hear you.
Oh, sorry. So, yeah, I walked out very quickly at the time that Bessie was speaking, so I missed the question. Was there a specific question?
Yes, there was a specific question from me. I know you work very closely with the Global Social Accountability Partnership at the World Bank.
Yes.
Allow me to say that you may have been a bit of an oddball, or GSAP a bit of an oddball in the World Bank, the same way that the OGP Multi-Donor Trust Fund in the World Bank is a bit of an oddball.
That's right.
So I want to get your sense a little bit of whether with COVID-19, the importance, what Bessinati was talking about, of social accountability of communities as claimants of rights, not just mere beneficiaries, which means they can point fingers and ask uncomfortable questions. Is this going to be amplified post-COVID-19, or do you think we're going to go back to business as usual of us community members being mere recipients of largesse from government and others? Where does the social accountability piece take off or wither?
Yeah. In some ways, well, thank you, Aidan. I hope this is not unique to COVID-19, that this is an overarching development principle, that people in communities are agents of change. They are rights claimants, and they are not simply recipients of what the government is providing or even the CSOs. So I think we can settle on that principle as fairly straightforward. I think that COVID being a serious health emergency brings that to the fore even more, because when it comes to people's health, nothing is more important than empowering them to have agency and voice, to have access to information, to understand, as Bessie said, their entitlements, and to use their right to access to information and expression to lay claim on those entitlements. So I believe that this is something that COVID will amplify because of the nature of the emergency. I would also say that in the context of the OGP, it may also be pointing to the importance of much more linkage of the future, if you like, country commitments, national action plans and commitments of the OGP to link to specific social accountability projects. I think we've seen examples of that in places like Mongolia and Paraguay, where we have supported social accountability mechanisms and found actually that linking them to those projects enabled the operationalization of those national action plans through social accountability programs that have a clear emphasis on access to information, collaboration of CSOs with government counterparts, and the participation of citizens citizens in the implementation of the programs.
Thank you. So there is, what I'm hearing from you is that there is hope in the future,
yes,
that it will not overwhelm the rights of citizens to actually hold their governments to account just because it's an emergency situation.
Exactly.
So
yes.
Let me see if there's other, Carolina, whether we've got Jeff here, there's some other people who may have a comment or two to make. Carolina, maybe you could tee them up and invite them in.
Yes, maybe Sol Gatonini, Laura Lacayo, there are some of the people. Agustin, let us know if you want to come in to answer some of the questions that have already been taken. Agustin, yes, you can come in.
Agustin? Is Agustin there? I can't hear him.
There
you go.
Okay.
So our participation in this program was due to a request by the Ministry of Health. One of the main issues that we have seen from this pandemic is the lack of, or the fact that this has had a much worse impact on fragmented societies. So we have a past of this fragmented situation because of this dictatorship and the types of government we have had. So once we started with this outbreak and the government saw the need of consolidating a collaboration relationship, the Ministry of Health asked us to be able to work specifically with the relationship between the Ministry of Health and the civil society. So we started building a link by means of a platform. In that platform, we were able to manage donations, and we were able to follow up and track and trace all of these donations. So also, I wanted to tell you a little bit more about the fact that what we're seeing right now is that the disease or the health issue as such is actually raising more collaboration efforts. It is also creating a higher engagement from the society because they are eager to collaborate with the government. And the second component of this outbreak is the financial and social aspect. On the contrary, well, we know that separation has gone broader, and we are again seeing more fragmentation from the civil society, and this political component as well is somehow driving this separation. So the relationship between the government and the civil society is being held up, and it lies on, let's say, the fact that we have more transparency. So to a certain extent, it depends on transparency, on unity, mutual trust, and all of this is based on transparency and accountability. So what we're doing is just really putting a lot of effort for us to make sure that this process is as transparent as possible, and that somehow is also sustaining and, well, somehow supporting this collaborative relationship. But the most important part of this, and in terms of the political area, is that we have seen certain breakage in terms of this trust relationship, because we have seen some sort of confrontations and other matters that have arisen. So another important aspect in our experience is that esa sería la última. So as of this relationship, we are increasing, or at least seeing an increase in terms of this
let's say we see a higher demand of transparency and accountability from the government, at least in Paraguay. I just got specifically a call to be more transparent, for us to be able to have a better collaboration, to continue in this process so that the civil society can feel represented by the government, to get more collaboration from the government and from people.
Thank you, Agustin. I picked a few things there, but the one that I think is really striking is, and I hadn't thought about it, but it's true, with the point you make, that there's a lot more collaboration now as a result of this emergency than what would have been in the past, between social societies and between society and government. The point George was making in Ghana about bringing civil society working much closer together. So that leaves me feeling a little bit more optimistic that this emergency can actually force us to collaborate further and really amplify the theme of this discussion that we're having. So we've got 10 minutes left, and I want to respect everybody's time. Many of you spent an hour and a half. I don't want to take an hour and 33 minutes. So I want to go back to our speakers and ask them this very simple question, and we shall go start with the top. What is your one key takeaway from this conversation that you've had here? What is your one key takeaway that you will think about and maybe go and develop for implementation? So we'll start with you, Luz, in Philippines. What's your one key takeaway in 1 minute that you'll take with you?
Well, there should be change of policies and programs now post scenario. The government right now has been instituting a amelioration program, giving cash to the most vulnerable sectors in our society. With inflation, the most vulnerable sectors, lactating women, elderly people, the very poor, out the most needy in terms of assistance coming from. We had a very strong collaboration with civil society before, with faith-based organizations. The challenge now is to make it stronger this time, because with a government already burdened by the financial assistance giving to the needy, then the private sector, civil society, have to be creative and innovative in order to assist our government, so that this sense of entitlement, which is now pervading because of the assistance coming from government, should be reduced, and that we should really be partners in development. And therefore, the challenge is that our civil society would be able to strengthen this collaboration and come up with their own programs, while government would see to it that there is a change in policies so that we address post-COVID situation.
Especially the most vulnerable. I think you said that in the beginning. Thank you very much, Luz. Let me invite John. Your one takeaway, please.
Thank you. For me, I think involvement, collaboration, partnerships, and inclusivity is more relevant now than ever. I've seen locally here the use of the word emergency by government. I'm government myself, and some of the local governments here have run to do the supplementary budgets with short-circuiting the budget transparency that we've gained over the years in form of open budget. So for me, involvement and inclusivity is more relevant now than ever. Thank you.
Thank you. Involvement and inclusivity. Don't shortcut the transparency system. I like that very much. Let's see who else here. Florencia, please. Yours, and then we'll George. You want takeaway?
I'm going to get a takeaway from the chat. The COVID context is a great opportunity to bring social accountability work on the front line and open government more closely together. It's easier said than done, but I'm very excited to see all the people in the chat that think that's worth the effort.
Fantastic. Yes, I know that's great. At least it's an uplifting thought. Let's not waste this crisis. Let's create some really good, long-lasting changes to our institutions going forward. George, your one takeaway, please.
So my takeaway will seek to answer Derek's question. So we not only have we been focused on providing humanitarian support to complement government efforts. Our government is receiving $1 billion from IMF. World Bank is giving some money, about $100 million. We have Parliament has approved 1 billion cedis, so a lot of money, and there's a COVID fund as well. Yeah. We are going forward. All the civil society groups that I talked about, we are harmonizing our governance initiative in terms of introducing innovative social accountability approaches. We cannot be going to the communities. So we are finding ways of monitoring the service delivery and monitoring the expenditure through innovative means to holding our government accountable. We have paid our dues in terms of the support that we are providing. They will have to account to us how they are using the money. Thank you.
That's fantastic. They've got $30,000 of yours. They can't just waste it. Jeff, I hope that is music to your ears, Jeff, about these innovative social accountability mechanisms that are going to emerge out of Ghana. When you find them, please share them with the rest of us. We'd like to use them in our own part of the world. Thank you so much, George. Bessinati, your takeaway?
I think my takeaway is similar to what has been shared on social accountability. And what I'm taking away from the call today is that there is agreement by a lot of practitioners and stakeholders out there, just looking at the chat and hearing the feedback, that social accountability needs to actually be amplified during this critical time, particularly in the post-COVID pandemic period. And there are questions around how do you adapt? And we also have heard that there are innovations. So I hope that we are moving forward to scale innovations that work and really collaborate together as different stakeholders. Thank you. Thank you.
On that point, all this collaboration, can I just please put a plug for the OGP website, where there is a very long list of innovations around COVID-19 from all sorts of countries around the world. Please put your ideas, George and Bessinati and Luz and John, in there, even if it's just one sentence, because then we'll find you and ask you for more details and see if we can collaborate. So I'd really like to put a plug for that. We've got 3 minutes left, Carolina. I don't know whether there's any points you want to make, or shall we thank people? Carolina, back to you, my co-host.
I would give just 1 minute to Laura, who had a local experience that maybe she can share on the chat and make a comment. And so as we turn up. Laura?
Yes, Laura. Hi, Laura. You get the last word.
Hola, muchas gracias.
Thank you so much. From Argentina, we wanted to share an experience where we are adapting a collaborative platform for neighbors can get together and report the conditions or the territory and the locations that are key, like dinings and health centers. We need to take into account this context that we cannot have on-ground information, but the neighbors that are located in different areas can bring information to know, and we can feed it back to the government. We will give you the link to our platform so you can learn more about it.
More collaboration and more social accountability using technology, using our neighborliness. Really, really fantastic idea from Argentina, from Philippines, from Indonesia, from Kenya and Ghana. So I think this has been a really excellent conversation. I've certainly learned a lot. There are about 150 of us or 130 of us on it. So allow me please to just say my thank yous first to the speakers for your thoughtful contributions. All of you were really taught me personally a lot. And the other important thing was inspiring. I'll answer the question about Tanzania before I head out. I'd like to thank Carolina and the government of Argentina and her team for coming up with this idea and for encouraging me to be a part of it. It's really been a fantastic journey. So Carolina, thank you so much. I'd like to thank the support unit who made this all happen really quite seamlessly. You know, you're all becoming IT gurus. I think we're all learning all sorts of new skills. I'm learning to be a teacher and a cook. Some of you are becoming IT gurus. I think that's really quite fantastic. But before I sign off, there was a very important question that was asked about Tanzania. And it was about a video showing or talking about the president, my president, suggesting that COVID-19 is a conspiracy because they tested the National Referral Laboratory with some disguised samples. Just from a personal note, that kind of thing is confusing and it's distressing. And so as civil society, we're trying to overwhelm that kind of negative messaging with much more positive messaging. So there's a campaign that we have out there to try and get Tanzanians to wear masks. Wear your mask, wear your mask, wear your mask. We don't have any lockdown. We don't have any of those states of emergency, but we're just trying to ask civil, ordinary citizens to collaborate and cooperate with each other and to protect each other by wearing a mask. I should have had my mask on. I would look like this. So on that front, protect yourselves, stay well, and I hope we will see you at other webinars that are coming up in the next couple of days. Thank you. Good morning, good afternoon, good evening, and Luz, good night.
Thank you very much. Tell your son we can see his hand over there.
It's my daughter. There she is. She's doing her studies. There she's wave to the world.
Thanks, Aidan.
Thank you.
Goodbye. Bye-bye.
Thank you. Bye.
Thank